mobile health clinic, over 3 years ago, a team got together and recognized that there was really a shortage of primary care providers for those people who are uninsured or underinsured in Greenville County. So rather than having a brick and mortar building serving really one community, the idea was to create a mobile health clinic that goes out and is able to serve multiple communities around Greenville County and really focusing on that uninsured population and underinsured.
30 to 40% of our patients require bilingual services.
We worked with business intelligence and looked at our areas of where most of our patients, our uninsured patients, live that were coming into the emergency room for non-emergent reasons because that was their only access to health care. So we looked at those communities and we looked at community partners there. So we work with community centers. Today we're out at the Mount Pleasant Community Center, who has graciously partnered with us and allowed us to take over their parking lot, and we serve the people in the Mount Pleasant community. We also work with churches. We work with soup kitchens. So anywhere that people in community may gather and that is walkable to people in those communities is where we decide to park.
Well, we see anybody regardless of creed, race, nationality, ability to pay, socioeconomic status. We treat them all the same. We don't withhold any service even as we see them based on their ability to pay. Any test we feel they need, we don't check with their insurance first. We provide what we think they need as far as diagnostic workup, testing, and treatment.
This is exam room number 1. This is a room that we use for touchdown space for the nurse practitioner and our paramedic. We will use this room if we have more than 2 to 3 patients. We'll use this room to examine patients. We also have a mini lab here. Our lab, we could test pregnancy tests, urinary tract infections, strep, flu. Different type of lab tests are done in this little mini lab here. This is our registration desk. When the patient arrives, we do patient registration from this little area here. We have a lab restroom for patients to do lab collections.
Getting to meet all different types of people. It's unbelievable to talk to some of these people, hear their stories and the things they've done, how they've ended up in the situation they're in, if it's a bad or worse situation. And also just the difference in all the people we meet, getting to go along with them and figure out, what we can do to push their health care further and get them some help they've been needing for a long time.
We've had quite a few of them, actually. It's a very satisfying role to be in. We typically see patients much sicker in more advanced stages of disease than the typical doctor's office would. One lady in particular that comes to mind, she'd been having abdominal pain and GI issues for a while. She saw us pretty advanced in the disease. We'd ordered an ultrasound on her abdomen, and she was actually a surgical emergency. The day of the ultrasound, had the test called to me. I immediately called the GHS admissions and got on the phone with a surgeon. We reviewed the case together, and she had surgery that very day. Later that week, she's feeling great, and she's doing wonderful. So it was a really good thing. If we hadn't identified that, she could have had some serious problems, ended up septic, possibly hospitalized in the ICU. I mean, she could have potentially died from it if her gallbladder had ruptured.
This is another exam room. This actually is a slide out. This room comes in, slides in when the bus is in operation, and when we're stationary, it slides out to make the room bigger. This is also supposed to be our room for GYN exams. And our last room is just a regular exam room. We also are able to do GYN exams in this room as well.
So we have over 70,000 adults in Greenville County that are uninsured. As a state that decided not to expand Medicaid, we have a lot of people who don't qualify for any kind of insurance. And so those people are often uninsured, or the underinsured population is often our Medicaid population who don't have as good of access to primary care as those who may have an employer-sponsored healthcare plan. And really, there are a lot of different communities within Greenville County where the uninsured reside.